everybody, it's Dr. Linda from the Vascular Birthmarks Foundation. Today with our special expert guest, Dr. Anna Duarte, Director of Dermatology, Director of the Children's Skin Center, and also Director of the International Birthmark Institute, all at Nicholas Children's Hospital in Miami, and yes, formerly known as Miami Children's Hospital. So say a big shout out and a hello to Dr. Duarte.
It's great to be here. Thank you so much, Linda, for inviting me to Facebook Live with you.
And today our topic is diagnosis and treatment of pediatric vascular anomalies, although she can pretty much answer any question on vascular anomalies. She's been in the field for how many years?
23 years.
23 years in the field. And who was your mentee trainer in Derm?
Oh, Dr. Roy Geronimus.
Yeah, one of our heroes, Dr. Geronimus. So and this is a wonderful weekend at Nicholas because we have our free lasers this afternoon, and we also have the conference tomorrow and the free clinic tomorrow. So anyone in Miami or anyone that can get here tomorrow is welcome to come still, right? To hear
Absolutely.
The lectures and to have a free clinic appointment. So we're ready to take your questions. Again, the questions are anything that has to do with a vascular birthmark, or she's a dermatologist, but that's what we expect is questions on the diagnosis and treatment, what may be new, the drug therapies, and also Dr. Duarte will be at our conference on Saturday, October 6th in New York at the Lenox Hill Hospital, and she'll be speaking and also participating on one of our on the Derm team with Dr. Geronimus and with Dr. Mim. So we see people are logging in. Thank you all for logging in. We have 1 hour for today's session. Hi, Daisy. Welcome. So, and also, thank you, Daisy, for reminding me. Dr. Duarte can answer questions in Spanish if you do not or are unable to translate. So our first question is from Alicia. My son, Mateo, just started seeing Dr. Duarte per Dr. Linda. She's fantastic. Looking forward to the Prima laser. Can you talk about the Prima laser a little while we're waiting for more questions?
Yeah, the Prima laser is developed by Candela, and it's actually a laser that's just been launched. There's only a few of them available right now in the country, and it's a laser that's going to allow improved treatment of the port wine stains because it's going to have more energy, so the laser can penetrate more deeply. It also has a cooling handpiece, which is a little bit, it's called contact cooling, so it's going to alleviate the pain a little bit better. So we have a benefit there as well. So we're really excited to have this new technology available to us very soon.
Hello, Sergey. We got a lot of people coming on. Our granddaughter has been on Propranolol. That question went by a little fast. So Ariane, hi Ariane. Yep, you're welcome. Alicia, sunscreen brand recommendation for birthmarks, I'm assuming.
I like a sunscreen that's at least an SPF of 30. That's what's recommended by the American Academy of Dermatology. It should protect you against ultraviolet A, ultraviolet B, and it should be water resistant. You should always remember to reapply the sunscreen at least every 2 hours. And if you're enjoying water sports, you should probably reapply every 30 minutes.
Thank you. So Melissa's saying her granddaughter's been on Propranolol since she was 4 months old for a hemangioma. Now, she didn't say anything else, but she's probably wondering how long should she be on it, and maybe what kind of results at 4 months should she see? You know, she's been on it for...
So she's been on it since she's 4 months old.
Right.
I guess it would depend on how long she's been on
Right.
it, but with Propranolol, we're really lucky to have this medication to treat infantile hemangiomas. It's really changed the entire game plan with treating infantile hemangiomas when it was discovered in 2008 that this medication can actually help. It completely changed the way we approach these lesions. We want to start the treatment early. So it sounds like your granddaughter started early, which is great. And you can see improvement within a week. We usually try to treat at least 6 months, but we may treat until a year and a half so that you can prevent recurrences. The hemangiomas tend to proliferate, and this proliferation period can last up to 18 months.
Thank you. So Valerie says she wants to know if there's any recommendations for treatment of CMTC. She'll be 44 and have a difficult time sitting. She has lots of pain, would like to see more permanent results?
Well, with CMTC, any residual port wine stain that's associated with this condition can definitely be treated with pulse dye laser. Certainly, you're free to email VBF some photographs and they can forward them to me, and I'd be happy to help you. I think in this case, some pictures would be very helpful.
And you can email Dr. Duarte at birthmark.org/Duarte, Duarte, and it'll go right to her. Oh, so Melissa qualified her question about her granddaughter, and she said she's 22 months old now, so she's been on it since 4 months, and she plans to stop at 2.
Yeah, in some cases, we do have to treat out to age 2. I've rarely treated patients to age 4. So in some cases, especially the segmental hemangiomas, the infantile hemangiomas that involve the parotid gland, require longer treatment. So I definitely think that that's something that's not the most common approach, but certainly I've had a few cases where I've had to treat that long.
And basically, it's you treat them as long as it's proliferating, or when you're trying to taper, it rebounds. So you kind of have to manage the lesion. Alicia wants to know if there's any commonality in blood type in port wine stains. I've never heard of it.
I have not heard of that, Alicia.
Kristen has a 3-month-old son with a port wine stain on his cheek and over his ear. He's currently had 2 PDLs. She's seen some clearance, but wondering if the pulse dye laser is the best way to treat a port wine.
Yes, absolutely. We recommend treating as early as starting at 1 week of life, and treating in frequent intervals. And the interval ranges in between physicians, but 2 weeks, 4 weeks, or 6 weeks, that would be the extent of the variation. So every 2 weeks, every 4 weeks, every 6 weeks, and you keep treating until you see that improvement. And who's treating your child?
Okay, she'll have to post that again. Oh, wait a minute, I just missed that
question. But I completely agree that pulse dye laser therapy is the best way to treat port wine stains, and the earlier you start, the better.
So Arlene Labustos from the Philippines, we do have a doctor there, Dr. Reiner Cirillo, and you can email me or message right here, and we will get you his information. She would like to know how we can get help for her Vela with Sturge-Weber. She's 5 months old. Basically, she'll have to see Dr. Cirillo, and there are many aspects, right, for the Sturge-Weber. I mean, it's not just a laser. She may need, glaucoma, eye drops, and may need anti-seizure meds. So it's best you email our Sturge-Weber syndrome expert. I mean, I'm sure you can handle it here, but you'd have to get here, right?
Yeah, so I agree with Linda. It's a multidisciplinary approach in dealing with Sturge-Weber syndrome. Mm-hmm. So you definitely need a team of doctors, ophthalmology, neurology, and dermatology for laser surgery.
Mm-hmm. And Jacqueline says she's 33 and she has a port wine. She hasn't had any surgery since she was 16. She had 16 treatments. She's followed up with any doctors. Oh, she hasn't. So should she? Wow, the lasers have really come a long way. So
the lasers have changed a lot over the last couple of decades. So I definitely would readdress treatment, and certainly we can help you.
Yes. So it's never too late to get back in the game, Jacqueline. And boy, I've seen people who've restarted treatment have amazing results.
Absolutely.
Wouldn't you agree?
Yep.
And Dr. Nelson had said at our last session when someone asked him, maximum clearance is what your stain will get. And you can still get it no matter what age you start. You can still reach some maximum clearance. So Randy, hi Randy. Randy has a 2-month-old daughter, and she's had her 3rd PDL yesterday on the right side of her face. The dermatologist changed her settings using 7.75 joules and 3 ms pulse width to target deeper. She does not have any purpura this time, and actually it looks like she didn't even have a treatment. Is this normal?
Well, when you start to widen the pulse duration, you'll have less purpura. And there's a couple schools of thought. There are a lot of dermatologists that believe that you don't need purpura, and some dermatologists that believe you do need purpura. And I think you can combine the treatments. I've certainly widened the pulse duration in some of my patients to capture those deeper vessels. So I think it's a reasonable treatment. You just have to wait and see what the outcome is.
Oh, so Jacqueline answered that she does have glaucoma and just followed through with that. So yes, that's an important thing people need to know too, is just because you have a clear MRI at 6 months, 2 years, 5 years, you're not out of the dark for the rest of your life. You always need to get a good eye checkup and maybe an MRI every 5 or 6 years as you get older, just to make sure, because it can appear right at any time. So, Christine, good to know that I'm from Massachusetts. He's currently seeing Dr. Wiss at UMass Derm. In Worcester, we are going every 2 weeks.
Every 2 weeks is great.
That's wonderful. That's a new protocol too, right?
It's a newer protocol.
So,
Dr. Geronimo strongly believes in that protocol. I also believe in that protocol. Sometimes we have trouble though, Dr. Linda, with insurance coverage with the every 2 weeks. So you definitely want to shorten the interval as much as possible. I tend to treat every 4 weeks.
So you're saying if insurance isn't an issue, ideally you would want to treat every 4 weeks.
Every 2 weeks.
Every 2 weeks if you can.
If you could, yeah. So, and once the purpura resolves, treat them again.
That's what I was going to ask. Is it just you're waiting for the purpura to resolve? And
you're waiting for the purpura to resolve.
So that's really good. It's really great. And how old do you start them at?
I start them as soon as the patient comes into the office, but if we can get the message out to the pediatricians, we can start them right when they get home from the nursery.
Right. So you're saying
1 week of age.
1 week of age. And you believe that it's more effective, or?
Yes. Well, that's what the literature would suggest. Yeah.
So we're behind that. Our done by one says get them started early and get them done by one, whether it's propranolol for hemangiomas, get them started early,
Absolutely.
2, 3, 4 weeks, or laser treatment.
Well, with the propranolol, we try to wait till 1 month because there's a risk
1 month.
Right. 1 month. Yeah.
1 month. The 4-week well baby checkup is
correct.
What we recommend. Yep. Okay, if your question doesn't get answered, you may also get in touch with Dr. Duarte. So we've got a little, I don't think we missed any. Alrighty. So any other new drugs coming out for hemangiomas? Or what about timolol that some people are using topically? Do you ever use it?
So I use combination treatment for infantile hemangiomas. So the ones that are more superficial, I like to use the timolol. These are eye drops that are useful for glaucoma. So we don't have an indication yet, so we're using this as an off-label treatment, but it's a great bridge treatment to propranolol orally, and also it's great for superficial lesions. And I also treat the superficial lesions with pulsed laser as well. So combination treatment, I think, is a really good recommendation.
Is there any written protocol stating the new 2-week recommendation that we can have for our insurance? So I can answer that, which is I've been working with Dr. Buddy Cohen out at Johns Hopkins, and we have a letter now of medical necessity that we're using that states to start them as soon as possible and to have frequency intervals of 2 to 4 weeks. If you write to me, Randy, at birthmark.org/Dr. Linda, I can get a copy of that letter from Dr. Cohen for you to use. We're actually working right now with the AAP on guidelines for treating babies with lasers, and we're hoping to put this in those guidelines so that it becomes normal that babies can get approved every 2 to 4 weeks or whatever they need, however long new lasers are coming along.
And I do think there's some information in the literature, in the published literature, about the 2-week interval being optimal.
Right. And again, it's probably vessel depth and size, and you just wait for it to cool long enough and you hit it again and you're getting
for the purpura to resolve. Yeah.
So thank you, Jordan. She's saying this is amazing information. Hi, Stephanie. She says, yep, how are you, from North Dakota? So we're taking your questions. Okay, again, that's if Dr. Duarte, if she doesn't answer your questions, or if we've missed any and you've been scrolling through, because sometimes they sneak by us, just resubmit your question. We'll be happy. This session goes until 1 o'clock, so we have 45 minutes left. I know some people will just start popping on and joining, and some people pop off. So, okay, that's another one. Ready? And once again, we have the very first Multidisciplinary Vascular Birthmarks Conference that's coming up tomorrow here at Nicholas Children's Hospital. Dr. Duarte is the director with her colleagues through her International Center for Excellence here for Vascular Birthmarks. And we will be having a lecture series in the morning, open to patients, physicians, anyone who wants to come in here, and a free clinic in the afternoon, correct?
That's correct. We're very excited and looking forward to tomorrow.
Yep. And there's again Dr. Duarte. So we're waiting for some questions. What do you recommend for adults with hard-to-treat Sturge-Weber syndrome?
Well, I can address the
stain,
the skin component. There are lasers. We start with the pulse dye laser, and we can certainly play with the pulse duration and the spot size, and of course the energy to try to get maximal clearing. And then if not, there is some literature to suggest that the alexandrite laser can be used as well, and also the neodymium YAG laser. So there are other lasers. You should probably see a laser surgeon. I'm not sure where you're from, but there's certainly some laser surgeons that have all of these wavelengths at their disposal to use within their toolkit for treating harder to treat, deeper, more cobblestoned or thicker stains.
Okay, so we're still waiting for some questions to come in. And also, you can review this video at any time. It stays on our website, on our YouTube channel, and it will be also streaming right now at Nicholas Children's Hospital. So, and also, I would like to thank Nicholas Children's Hospital for doing this. Great birthmark weekend for people and families that are all over the world that are still lacking appropriate information and delaying treatments and living with a birthmark that do not need to live with it. So every time we hear about a new treatment center, we're very excited. So we're excited to see this grow.
I think you made a really good point that we're trying to get the information out there so patients can get in for treatment early. And just recently I saw an almost 1.5-year-old child that came in with a large hemangioma, infantile hemangioma on the scalp, that again, the physician had recommended the watch and wait approach. And we really do have a lot of treatment to offer, very safe and effective treatment to treat early so that you don't have to go through that, your hemangioma doesn't have to go through that proliferative phase and then leave a lot of residual tissue that disfigures the skin in many cases.
So Kim wants to know who are the Miami area specialists that are associated with your practice?
So
in your team?
On my team, we really, the entire hospital, all the pediatric subspecialists participate. So we work with the pediatric cardiologist to clear our patients for propranolol use, the hemangiol, which is the FDA-approved medication for this. I work with interventional radiology for different venous malformations and arteriovenous malformations. Dr. Ricardo Restrepo leads the team in that department. Work with plastic surgery, Dr. Chad Perlin, in case the patient needs surgery. Excisional removal of some of these lesions is quite effective and reasonable. We work with ophthalmology in case the hemangioma is around the eye. Dr. Roberto Warman is the contact person there. ENT, we have a great team here. In case the hemangioma is on the lower third of the face, you might have airway involvement. If you have the clipple-tendon, we work with orthopedics, pediatric orthopedic surgeons here to help us manage the overgrowth of this of the extremity in those cases. So it really does take a combined, multidisciplinary, comprehensive group to address a lot of these conditions.
And I'd just like to add that Dr. Perlin is fast becoming an international expert, right up there with the top, like Dr. Wayner, Dr. Hockman, for the surgeries, and that's what we've needed is, you know, a new group. So Mindy says, thank you, loves following you. She wished she knew about it 5 years ago. Her daughter has an inverse hemangioma. They treated her with propranolol at age 3 months till age 1. She's now about to celebrate her 6th birthday. Her lip is still swollen a bit, but the red is gone and the bruising color. And I've been hearing about that with, you know, patients that are 10, 11, and where their hemangioma was, it swells.
Well, it sounds like there's a little bit of a residual change. And again, treatment is very good. And it sounds like you got excellent treatment. It sounds like you started early and went the course to age 1. There may be some small residual change that the child will outgrow. Or in the future, perhaps needs to have a very minor adjustment. Maybe some laser can help with that coloring as well. Yeah. So I would definitely see a pediatric dermatologist or a dermatologic surgeon that does laser surgery to see what the options are.
And that tissue is still hypervascular, but it will eventually stop. You know?
It will stop, and a lot of times you get some fibrofatty change, which the propranolol started early can actually prevent that. And that's what causes a lot of the permanent distortion in the skin. So, but it sounds like everything was done very well, and sometimes, you know, it's just not 100%. which is what we'd like to see.
Right. So Alicia says, can you talk about a sonogram for port wine stains?
Right. So I think I mentioned this at our visit, and at the last American Academy of Dermatology conference, some pediatric dermatologists are starting to look at ultrasounds actually of port wine stains. And what they're looking at are called V waves. And depending on how quickly the flow is through the lesions, you can kind of predict how well laser is going to work on those lesions. And you can also tell once you do the laser, depending on how quickly the purpura fades. So if you get some purpura and then it immediately fades, it suggests a faster flow lesion. Sometimes these are going to be a little bit more resistant. And so ultrasound is a little bit new on the field, but I think it's going to become a more useful tool to start to look at outcomes and predict outcomes better, and even where we can map our laser and target maybe a deeper treatment in certain areas versus others.
Well, I'm great. I just learned something new.
Yeah, that was actually very exciting.
Yeah.
Dr. Alona Frieden was part of that panel, and it was
awesome.
Very exciting. Yeah.
So we got a lot of questions coming in now. Randy wants to know, and you mentioned this before, just when will the Prima laser, do you think, be in the general market?
I believe Dr. Roy Geronimus has a Prima in his office in New York.
And Dr. Nelson's getting one delivered.
And I believe those are the two that are currently out on the field. And hopefully at Nicholas Children's we'll have one in the next quarter or 2 quarters. We're working.
I would say probably a year from now they'll be out there.
Yeah.
Wouldn't you say?
They're building them by order. So we are currently in negotiations to get our Prima laser here because we always like to keep technology at the latest. And this is now a step up from the V-Beam Perfecta.
Okay, so Erin wants to know, do you think there will ever be a laser that will completely remove the port wine stain so it will never return? We're
hopeful. We're getting closer, and we're hoping that some topical medication may also be able to help. We got really excited about the topical rapamycin, and the jury's still out, and we may not know how to use it exactly in the best fashion yet, the topical rapamycin. And we got very excited also about the imiquimod, to use that in combination with lasers. And the Prima is going to go deeper. It has more energy. So certainly that's also a big advance. And certainly we've come a long way from the argon lasers, where we just replaced a port wine with a scar. So we've come a long way in the last couple of decades.
Good point.
And so I do believe that we're heading in the right direction.
So we got some more questions. Erin wants to know, any thoughts on long-term side effects of the Rapamune sirolimus? Our KT kid has been on it for 4 years. He's 7, doing well on it, but wondering how it may affect him down the road.
I really can't speak to the long-term effects of the oral sirolimus. Unfortunately, I don't have a lot of personal experience with that. But certainly, if you want to email me, I can find out from the hematology oncology part of our group, because we do work with them and they manage those patients that require that.
Right, and we have some experts on the VBF website. Dr. Bly answers those questions as well. Summer wants to know, she's 37 and she has a hemangioma on her leg. Can you tell me more about the clinic in Miami tomorrow? I haven't seen a specialist in over 20 years. So
definitely you're invited to come. We'd love to see you. We can schedule a consultation. When you register, you can just ask for a consultation in the afternoon, and Dr. Restrepo, interventional radiology, Dr. Perlin, plastic surgery, and myself will be there to have a disciplinary evaluation, multidisciplinary evaluation. And I think it'd be great for you to be checked, because the hemangioma in your 30s is not the most common, and most of them would have been voluted. So we need to make sure that the diagnosis is correct.
And you should come, Summer. You have nothing to lose. Deborah said her child has port wine on chest, arm, hand, and leg. Should she have an MRI? We know she has Sturge-Weber syndrome. Do you think anything else? Do you know anything about the RASA1 gene? She's getting tested for that.
I think that, she may have a capillary malformation with overgrowth syndrome. And I'm not sure about an MRI particularly, definitely as part of the workup for the Sturge-Weber that is indicated. But I'm not, I think that she may have capillary malformation with the overgrowth, and that's why they're doing the genetic testing.
Right, which could be KTS or Parks-Weber or, right. right? Could be.
Well, could be as well.
Right, yeah, you could be. So Yvonne says her niece is 5 months old. She has a hemangioma in her cheek. She's taking propranolol pills. I know there is a propranolol in syrup. Is there any difference with the pills?
Well, yeah,
I don't know about the pills.
definitely, you know, propranolol pills can be compounded in a compounding pharmacy to make a syrup and then administered. But propranolol already comes in a syrup. I recommend, now that we have an FDA approved drug that's been proven to be safe and effective, and we actually have labeling for the treatment of infantile hemangioma, and we have really good guidelines for treatment, to get your child on the hemangiol. And I know that they have patient assistance program if for some reason it wasn't to be covered by your insurance. Mm-hmm. But I think it's more standardized. I think that when you get into compounding, all pharmacies are great at doing this. There's really no reason. And definitely there's liquid propranolol. It comes in a 20 milligram per 5 cc's and a 40 milligram per 5 cc. So I would speak to your doctor and look at the options, but I would go number one with the hemangiol.
Right, and I was actually going to bring that up in one of our quiet times, that so many parents have GERD problems, reflux problems on the generic, and then we just recommend that they switch to the hemangiol because it's not just FDA approved, it's different than the generic. The ingredients are more, I guess the word is palatable for the babies, and so the babies are more apt to not throw it up. So for that reason, we suggest if you can get the hemangiol, to get the hemangiol. Like, that would be our first recommendation.
They spent a lot of time studying the taste of the syrup. So, and in general, the kids, the babies take it very well. Yeah.
So Hinge says that her girls has a port wine stain, but something is itching her. So I guess some people do complain about that.
You can have some eczema associated with a port wine stain. And so usually you just get a little topical steroid to deal with that component, but it's not uncommon at all.
So Kim would like to know what will transpire tomorrow at the clinic. So maybe you can talk a little bit about just the conference lectures and then the clinic.
Absolutely. So tomorrow we're going to start registration at 9, and we'll have a light breakfast. And at 10 o'clock sharp, we're going to start our talks. We're going to have a lot of the doctors from the multidisciplinary group present. We're going to start our talks with pathology. So you're going to get to see what some of these lesions look like under the microscope. We're going to have a geneticist, our clinical geneticist, there to talk about some of the newer updates that are going on with the genetics of vascular anomalies. Our interventional radiologist is going to speak as well, just on the differential diagnosis, and not everything that looks like an infantile hemangioma is an infantile hemangioma. Oftentimes, you might have a misdiagnosis, and so it's important to look at the differential. We're also going to have myself. I'm going to speak on treatment of infantile hemangiomas, treatment of port wine stains, and also selecting a setting, whether you're going to have treatment of your child in the office with laser or in the operating room. So we'll also have an anesthesiologist to talk a little bit about general anesthesia. And what am I leaving out?
I will be talking about our anti-bullying and the psychosocial impact on the families. Yes. Very important topic.
Absolutely.
And, so Melissa, she's heard you talk, or we've been talking about the RASA1, and she wants to know, because she's seeing a geneticist, like what is that for? I guess the genetic testing is for the RASA1, right?
They can do what they have, these chips. And they have a vascular chip, and usually they will test that chip to see what mutation is associated with your child's vascular malformation.
So Erin said she noticed her daughter has port wine on part of her tongue. Is there a treatment for that? And is there any complications with speech due to this?
In general, our lasers are not to treat the mucosa, so I really have not treated, for instance, the gingiva or the tongue with my pulse dye laser. I think we would have to wait and see how that evolves. I have not heard of a complication with speech. Certainly, if the child gets macroglossia or overgrowth of the tongue, then that's something that can be addressed. And actually, one of our surgeons here is an expert at tongue surgery, but I think that would be way down the road.
So Deborah wants to know if you've ever successfully used it to treat a hand, and her daughter's is on her hand. It says, and that's kind of an old fallacy, right? That the laser doesn't work on the extremities. I mean, I know it's more difficult, but
it takes more treatments.
It
takes more treatments for the laser to be effective. The more distally it comes from the core of the body. So I've definitely improved port wine stains on the hands and on the feet, but it is a little bit more challenging. Also, the lower extremities can be a little bit more challenging as well.
Peter wants to know if there's anybody in Tennessee. He went to Vanderbilt and talked to the doctor. That was ours, but nobody wants to mess with it. It is very hard to find really good multidisciplinary teams and specialists that understand, but
we do have pediatric dermatologists in Tennessee. Again, I don't know right offhand, so if you please email the VBF with the / Dr. Duarte, right? Is that correct?
Duarte.
Just
birthmark.org / DUARTE, Duarte.
And I can certainly look that up for you.
So Kim says, as Dr. Duarte described the clinic, the word hemangioma was used more than port wine stain. Are the terms interchangeable?
Oh, no, absolutely not. So we're going to talk about nomenclature, which is key. So just very briefly, vascular anomalies are divided into two main categories. You have your tumors and you have your malformations. So under the tumors, there's a whole long list of conditions. Infantile hemangioma is a benign tumor. I mean, most of the tumors we see are benign, but they can have a lot of morbidity or problems associated with them. But there are some malignant tumors as well. So it's important at birth, especially early on, to make this distinction. Then you have the whole category of malformations. Capillary malformations, those are the port wines, but you also have venous, arterial, and arteriovenous. So, and lymphatic. So, we're going to talk about all of it. I'm going to talk mostly about port wines and infantile hemangiomas, but our interventional radiologist is going to spend some time talking about the malformations.
Thank you. So Trista's, I'm not sure if you're treating, but she said she's very impressed with the 6 treatments her son has had on his face. So thank you, because we know laser works. And VBF is an advocate for people who choose not to treat. We just want you to know that it is a medical issue. It's not cosmetic. We don't even allow that word to be used in our foundation, because none of these lesions are cosmetic issues. They're all malformations. So
and there's a big psychosocial aspect that you're going to be speaking on tomorrow.
Yes.
But there have been studies that have shown that children with facial vascular birthmarks left untreated may have self-esteem issues, and that's been shown statistically significant in the literature. Mm-hmm. So it's important to address these.
So we're halfway through. We have 28 minutes left, but we're more than happy to answer your questions. And Erin just asked, can an area that has a port wine stain be a little more swollen?
Absolutely, yes. And this is the underlying hypertrophy of the tissues that are sometimes associated with a port wine stain. So you can definitely see that. And at this point in time, we don't have real good control over that overgrowth that occurs with the port wine. In the future, if there's something more persistent, certainly plastic surgery can address that.
And one of the things I've read in the literature, I don't know if you've what you've come across, is that 70% of the port wine stains will have changes. So either thickening, darkening, blebs, and that's why the recommendation is to treat early, where some may have no changes.
Exactly, and we can't predict in the beginning.
Right.
I mean, we can't predict early, so we recommend early treatment for everyone to get around this problem of the thickening and the cobblestoning that occurs. But this is the superficial aspect. The deeper aspect with the bony involvement and the muscle and the overgrowth is still something that we're grappling with.
And do you still treat some with anesthesia and some without?
Correct, yes. I do most of my lasers in the office under just, maybe some topical, but mostly just use the DCD, which is the dynamic cooling device that the laser has built into it. Most of the children can get through this. The great thing about laser is quick, and we can get through the treatments quite easily.
I tell the parents, Dr. Geronimus is the fastest gun in the West. He lasers so fast because they're like, and I actually timed it like seconds. So they have no way of knowing, like, a port wine stain that may be on the cheek of a 3-week-old may take you less than 45 seconds?
Absolutely. We can have treatments as short as 5 seconds to a long treatment would be considered a couple of minutes.
And I tell them, some kids get circumcised, it's more painful, and they get their vaccinations.
Yeah, we can get the kids through it. Yeah, we're going to talk about that tomorrow, but it's definitely a procedure that in many cases can be done in the office, and you don't need general anesthesia.
We're very happy to help, Erin, and I'm glad you're thankful. Pete says, at what point do you reach diminishing returns with respect to laser treatments?
So I would say that when you stop having any kind of purpura or bruising, the laser is not working, and then you need to look at different laser systems, different wavelengths, perhaps. We're talking about, let's say, PDL. So if you have a PDL that's the 595, and you've stopped responding, they widen the pulse duration, shorten the pulse duration, increase the energy, change the spot size, and there's no laser tissue interaction, then it's time to perhaps consider an Alexandrite laser or an ND YAG laser to see what can be done.
Well, also one of the things that we talk a lot about, I've used this protocol, and so does Dr. Geronimus, which is if you have 2 subsequent treatments with no clearance, then it's time to take a break.
There's also that, yes, absolutely.
Yeah. If the child has a port wine stain, maybe the second child also. She's concerned because
that's a valid
congratulations, Hind.
Yes.
I know the baby's coming soon.
So I don't think that's been predicted at this point at all, that there's a genetic connection to that level. It's still considered very sporadic.
Well, what I tell everybody is I probably see, meaning through the internet, I get 165 new patient inquiries a week. And in 24 years, I've literally seen probably 200,000 pictures and people. And I've only seen a handful that a second child has had a port wine. And if the first one's, pretty consistent, if it's takes up a good space, the second one's never worse. And the same with hemangiomas. I've always told parents that it's rare. It can happen with the subsequent one, but it's never like the first. It's not exactly the same.
Totally agree.
Yeah. Okay, I missed a question. So do you treat over the eye using an eye shield for an infant of 2 months? Our dermatologist has not been able to find a shield small enough.
Yeah, they actually make the shield. So you can email, and I'll try to get the vendor. I'll be happy to help your dermatologist find the shields. They do make them quite small.
And I've watched those be put on. It's such magical. They just pull it down, pop it on, take it off. I've seen it done in newborn babies. It's impressive. And Dr. Geronimus, Dr. Nelson, Dr. Duarte do not laser the eyelid without a corneal shield.
Correct.
Right? So that's very important, parents, that you know that. Don't let anyone laser because you can damage the eye.
I don't know that the laser would penetrate through the lid, but it's not worth taking a chance.
The risk, right?
Certainly, you can treat the area over the bone without a shield.
Right.
If it's up top, but definitely the
not
lower
the
lid.
eyelid. Yeah. So Trista said the main reason we sought out treatment while our son was an infant was because of the self-esteem issues he would have. Oops, sorry. Okay, let's see back here. Because of the self-esteem issues he would have as he gets older, we are comfortable where it's now as he gets older and he can decide for himself.
Absolutely.
That's the best barometer. And I've had people in schools start right in the beginning. They read the Buddy Booby birthmark book, or the parents go in and educate the kids in the class about it. And it helps the kid to be accepted, because our motto is knowledge is what dispels ignorance. And by ignorance, I just mean people just don't understand what a birthmark is. And so they say things. And we're right on top of that. So he can decide himself, and you can decide with him. So we're 100% behind that. Hi, Lucy. Her daughter has a birthmark on her arm and hand. With laser work, I've been told that it wouldn't be effective. And do all birthmarks cobble?
So when you're saying birthmark, we're presuming it's a port wine stain.
Mm-hmm.
Yeah, the laser will work. Again, on the arm and hand, it's a little more challenging the further away you get from the center core of the body. But I've had good improvement. I've treated a lot of patients involving the extremities with good outcomes.
Hi, Jody. Thank you for logging in. So Lucy says oh, we just did that one.
Yeah.
Okay, thanks, Lucy. All right, guess we're caught up for this moment. It's almost 20 of. We have 20 minutes left. And once again, if you missed something Dr. Duarte said about the new Prima laser or about Purpra in treating, or if the extremities can be treated, or the Rapamune, sirolimus drugs that are being used, you can always go back and review the video. It'll be on our website. It'll be on YouTube, and it may even be made available on your on your institute's website.
Yeah.
Do you have a web address for the International Birthmark Institute?
Yeah,
here?
Through Nicholas Children's Hospital.
Okay.
Yeah.
So they can find it there. Good. Nice to know, and I'm sure that has a lot of information for them that they will want to know about this. So Tracy just wrote, and she says, we are very excited to hear about the Prima laser. We currently see Dr. Badia in Fort Myers. Do you think this new laser will be available to all offices? We would love to have more treatments for my 13-year-old, but keeping her out of school due to bruising each time is difficult. Can we effectively treat without bruising so she can have treatments more often?
So just want to give a shout out to my good friend in Fort Myers, Aurora Badia, and she's your dermatologist. She's excellent. I think that with regards to
13-year-old. So it's
with regards to the bruising, there's the two schools. So I believe that you need some bruising to have an effective treatment. But if you widen the post-duration, you may get less bruising. And the only way to know is to try and see if you're getting some clinical effect. But I like my patients to get some bruising. I feel like that's the most effective way. But again, in dermatology, there's two schools, and there's a lot of people that don't believe you need a significant bruise. So I would try.
I'm glad you said that, because a lot of the patients are going to email me and say, why does Dr. Nelson always say you don't need bruising to have clearance? So you just brought up that there's two different schools, plus the wavelength, the settings,
Correct.
and the duration, and how they use the laser.
Absolutely. And some lasers,
varies.
the Nd:YAG, for instance, is not going to bruise you as much. So it depends on which laser you're using. The Alexandrite is not going to bruise as much. So it depends what laser is being used.
So Krista says her daughter is 12. She was born with a large VM on her eyelid. So many surgeries have been done, and now we're dealing with the emotional reality of what not looking normal does to a young lady. Sorry to hear about that, but one thing, Krista, please make sure you contact me at birthmark.org/Dr. Linda, because I do want to make sure that you do at least get a free opinion from Dr. Aaron Fay. He is our orbit expert. He's #1 in the world and wrote the only orbit textbook on vascular anomalies of the orbit. So if she's having repeated surgeries and still having it recur and having some issues, then I would like you to get at least a free opinion from him. That's my primary thing. And the not normal, again, that's why we have our anti-bullying program, which doesn't help her, but we are there to support that. And well, I would just like to make sure she gets an accurate diagnosis and looks at treatment options.
Dr. Fay is excellent.
Yeah. So just email me, Krista, again at birthmark.org/Dr. Linda, or you can post here, and then they'll make sure they get that to me. I just want to make sure, because the VMs of the eyelid are very tricky. I just want to make sure we didn't miss anything. That was Dr. Padilla. Kendra says, speaking of eyes, her son has a port wine on his eyelid, and he's 17 months. He's had 2 treatments on his face, but not the eye. Our doctor doesn't want to start until he's 4 years old on his eye, because he's worried about scarring and the eye drooping because the skin is thin there. We go to UNLV in Las Vegas. How can I help advocate it without stepping on a doctor's toes? Excellent way of putting it tactfully.
A physician can only do what they feel comfortable with, and I sometimes don't treat the lid until age 1 in some cases, and I do treat the lid in the operating room depending on the extent of the port wine stain. So even with and I put shields in myself as well. So even with my experience, I have different choices depending on the patient. So it has to be what the physician feels comfortable with. A 17-month-old in the office might be challenging to put a shield in. and the doctor may not feel comfortable. That doctor may have operating room privileges, or you may find someone in the area that has operating room privileges to help with this process. I mean, 17 months old might be a little challenging. It's easier to put the shields in the infants. You have better control.
Yeah.
17 months old is getting to that point where, the child may have to be quite restrained, and sometimes will fight you a bit putting the shield in. It can be done, but it's a case by case. So I would just openly speak to your doctors. We're here to advocate for you. Right. And if a patient came to me and said, I need something done and I don't feel comfortable with it, I'm going to help them find what they want. No doctor's going to take offense. No one's going to feel that anybody's toes are being stepped on.
And Kendra, I'd also like to suggest you can go to our website at birthmark.org/conference. We do have the conference in New York on October 6th. Dr. Geronimus does the free laser treatments on the 5th in his office. I've been in the room where he's done 2- and 3-year-olds with the corneal shield. It's just, he's so quick. I don't even think the kids know the shield. And that, like Dr. Duarte saying, is what he's comfortable with. He's been doing this since 1980. And like you said, you have to build up a comfort with doing this type of thing with kids. But you can send the picture in and tell his assistant your concerns, and she'll let you know if he can do the free treatment or not. But it's worth it for you to, if you came and got the treatment, then you could go back to your doctor and say, look, Dr. Geronimus was able to do it, and maybe Dr. Geronimus could call him or email him or communicate with him. But I just don't want you to give up.
And I don't think you have to be worried, though, about the droopy lid. That part of it, I think that's not an issue.
Yeah, I mean, she may be thinking, too, that some of the eyelid hemangiomas get hypertrophic, and then they get thick, and then they have a little drooping. That's likely not going to occur. It's a port wine mixed with hemangioma, Lucy is saying.
Interesting.
That's not a diagnosis.
It's not common.
No.
I would have to see that. I mean, I'm not saying that it couldn't happen, but we usually don't see the two of them together, but it could happen, I guess. Yeah.
And you have to remember something. The word hemangioma means benign vascular tumor. That word is used universally to describe everything vascular. So they could say hemangioma port wine just because that's what they called it. But it could really be either one. Like, it could just be a port wine or just be a hemangioma. Don't you agree?
Agreed.
Because of the nomenclature.
Yes.
Yvonne said, do you recommend timolol in gel or in eye drops? Any reason for using one over the other?
Well, I think the gel is easier to stay in place. The parents sometimes complain that the drop is too liquidy. So I like the gel forming solution. That's what I try to recommend.
Okay. Oh, so Krista, you're saying Dr. Fay operated on your daughter's eye? Well, it doesn't get any better than that. Yeah. So you can message me. I'd like to see your picture because it sounds like it must be pretty aggressive. I'd like to see, though, Krista, if you'd send me that picture. Pete wants to know, do you only treat children?
So I treat children and adults. So I'm boarded in pediatric dermatology and boarded in adult dermatology or general dermatology. So yes.
So Pete, you can take a little trip from Tennessee to Miami and see Dr. Duarte, right?
Yeah.
She'll be happy to see you. And you can come tomorrow if you want to hear the lectures. And get a free clinic appointment with her. Amanda said she just jumped on. You can go back and watch this whole thing after we're done, Amanda. It stays on our website at birthmark.org indefinitely and on our YouTube channel. She was born with a large birthmark from her toes to her bum on the left leg. I'm now 38. Is there a treatment? So sounds like a port wine.
Yeah, it could be. I trust that you're speaking about a port wine stain. There's definitely treatment for you. Again, laser treatment is a little tougher on the extremities, but it does work. You should definitely be evaluated. I would need a little bit more information. You could perhaps send pictures to the Vascular Birthmark / Dr. Duarte, and I can take a look and give you more specifics.
All right, so Kim has an interesting situation. 7-month-old grandchild with port wine on left buttock to sole of foot. First treatment is scheduled for May 8th in Coral Gables. The baby planks rather than crawls. Could this behavior be associated with the port wine stain on her knee, or likely just plain old baby maneuvers?
I think it's just a plain old baby maneuver. They don't tend to be painful.
Right.
Yeah. Good luck.
Yes. So Ashley says her daughter had 4 treatments for facial port wine with great results. Started at 2 months. Good for you, Ashley. You are one of our early intervention moms. Thank you. She finished after her first birthday. Yay! It's been a year since the laser, and now I'm noticing a slight return. Okay, to be expected. The doctor originally said we would revisit when she's 3. 1 year from now, wondering, and what a great question.
Yeah, it is a
Do
great
they go
question.
by time, or do they go by when the stain starts to recur?
I wouldn't go by time. I would go by when the stain is recurring. And what you do is you can lengthen the treatment interval. So in the beginning, you had 4 treatments starting at age 2 months. So every couple months you had a treatment. Now maybe you just need maybe 1 or 2 treatments a month, a year rather, 1 or 2 treatments a year. But you definitely don't want the stain to reoccur. And even at 100% clearance, I've seen this in conference time after time, at 100% clearance, 3 years later, you see that stain coming back.
Right.
So it's really important to stay on it.
I couldn't, agree more. And we try to tell people, even if you can get something to externally cure a port wine stain, because it's believed to come from the central nervous system, the deficiency, doesn't mean it's cured. It can come back.
Yeah.
So,
right now we have no cure. We have really good treatment and we're getting better, but no cure yet.
There's a note from someone from Bulgaria, and it popped up on my phone, but I don't see it on here. So just if you can cut and paste that, I'd like Dr. Duarte and myself to read it. Dante said his son has a vascular malformation on his leg. Have you ever known these children to take blood thinners? Common DVT, and again, that's likely, I think I remember his son, and it's a type of KTS.
Yeah, I mean, yes, these kids, again, I don't manage that. We have a hematology department here that works on that aspect, but yes, absolutely. Sometimes the blood thinners are part of the regimen.
So Jessica said her 8-month-old has a mixed hemangioma on her back that started at 2 weeks, very common. She also has a birthmark on her cheek. They originally thought was from the use of forceps, but it never went away. They say it's a stork bite, but I feel it's an odd location. It doesn't seem to be fading. Is it possible to have a stork bite on the cheekbone area, or is it something else?
It's most likely a port wine stain.
Yep.
Yeah. So there's really good treatment. So see your local dermatologist, and if they offer pulse dye laser surgery, that's the treatment of choice.
Okay, why don't more doctors treat? Is it purely economics, or they scared to treat, or a combo?
It's not everyone has access to the technology. It's not affordable for some physicians to have it in their office. It's expensive technology, so that may be part of the limiting factors. And training, not everyone is trained to do laser.
Right.
But I think definitely physicians that can get the training and have the technology want to help. We want to help the patients.
Right. So Laurel mentions it's good to get this discussion about the genetic mutations going. We know that Dr. Comey's paper with the discovery of the Sturge-Weber port wine stain gene, and then this whole RASA1 issue has been coming up. And the one thing I want to say is this: we can discover every gene mutation for every disease going. That doesn't mean you can prevent anything.
Yet.
Because, yet. You might be able to change it, develop a gene therapy that can reverse it or stabilize the condition. But right now, if you find a gene for a port wine or Klippel-Trenaunay or Sturge-Weber, it's not an automatic,
Right.
Now we can cure it.
Right.
So
absolutely, but it's on the right track.
It is,
Yeah.
and so it is important. It's just that a lot of the moms write to me and say, well, what will happen if my son has the RASA1? Does that mean he can be cured or he can't?
No.
So
right now it's not affecting therapy, but it's good to know, and it's certainly important to do the genetics and to have because it's our pathway to instilling better treatment in the future
and to developing therapy.
Absolutely.
That gene therapy is what's being used in a lot of cancers.
Absolutely.
And a lot of
a hot
other
topic now.
Yeah,
Very exciting.
So Laurel, when VBF starts ramping up and gathering a lot more information on these genes associated with vascular anomalies, you'll have to get involved with us and be our gene ambassador.
Our clinical geneticist will be giving a talk tomorrow because we realize the importance of the genetic aspect of these malformations.
Yes, and I'll be taking notes at that too. Okay, vascular malformations in babies, and yes, we do. Dante said we do vascular malformations in babies and young youth. I'm not sure what that's about. So Kendra said her sister's son is 5, has a hemangioma on his forearm, 2x3, slightly raised. Doesn't bother him. They're wanting to do a wait and see, which is common. Is there anything else she should do or ask, or is this appropriate protocol?
It's a benign growth. It's on the arm. Certainly that's still an option as long as parents know all the options. I tell the families a lot of times, you don't have to treat, but I think families should be aware of the options. And I don't think you should not treat because you're afraid the treatment can be harmful. With good monitoring in the hands of a trained physician that's familiar with the medications, can be used very safely when we're talking about the hemangiol, the propranolol. So if you choose not to treat, that's okay, especially on the arm with a small lesion. But just know that there's good treatment available. The parents that are disappointed are parents that come in and say, oh, we wish we would have known there was an option, there was a different option for our child. So I just think it's important for people to have information and awareness that there are safe and effective treatments.
Well, we're almost done, but now I remember Dante's mom. She's writing for the Dante DMC, and he did pass away from his vascular anomaly. And I hope you'll come to our conference in New York City, because I really would like us to have more of a specific awareness on the rare number of these that can have fatal implications, but one is too many.
Yes, absolutely.
So I've talked to you about this. I'd really like to meet you in person at one of our conferences to find out what it is that we can do to get the word out into the American Academy of Pediatrics, or whether we take it out into the general physicians, or what, that these are not just all little benign hemangiomas, and that sometimes we have to be aware of some hidden complications.
I think it's really important to, when you have a vascular birthmark, to at least be at a center where you have a multidisciplinary group of doctors. As a dermatologist, for instance, that's an aspect of the condition that I would not monitor. So I think that's something that's really important, to have a multidisciplinary full team behind you, especially with these more complicated lesions. But what happened to your child is extremely rare.
Right, she knows, but I've also told her, because her son's story just touched me, that I want to do more in that specific area.
Yeah.
I've heard over the past 24 years of several other similar cases where they just thought it was just a birthmark,
right,
but it had, some real high flow problems and some thrombocytopenia. So Laurel, again, who's talking about the gene thing, she said her daughter did not come back with it. She's undergoing it. She went underwent the genetic testing as well, and she said we have the same mutation, and came out, I guess MRI and CT came out abnormal. They see blood stain on my parietal region. So they did a cerebral angiogram, and yes, I have a brain AVM. That's very interesting.
Wow.
I don't know. We'll have to talk, Laurel. I'm not sure where you're located. I don't know if you're in the U.S. or if you can come to one of our conferences. But, when we do some of our brainstorming on research, and as they begin to explore more on this genetic stuff, maybe there is something that we need to look at in the parents that we've never looked at. We've never thought of this extensive testing in the parents of children with vascular anomalies.
Well, at the conference that I attended, and this is in the hands of really high-level laser surgeons and pediatric dermatologists, some of the port wines, some of the lesions that appeared to be port wines, that's why they were doing these ultrasounds, actually turned out to be AVMs.
I know, and Dr. Mim has said the pathology is different. He says the stain for a KTS is not a port wine.
That's correct.
So I think the more, and just when ISFA got the classification down, they're going to have to do it again.
They have to do it again.
Yeah, because the more we learn, And that's why what you said before with the sonograms and ultrasounds are so important, is even before you begin treatment,
Yes.
know what you're treating.
Exactly. And it can be very tricky.
And you've seen things that walk like, look like, and talk like, and quack like a port wine stain, but they are totally resistant. And you're probably now thinking maybe that was an AVM. But who knew 10 years ago?
Right.
And this is all new and all new awareness. So we'll take one more question. So Nicole says, she has benign tumors treated with medication. Her daughter was born with 3 on one finger. Okay, only last year in October she had 8. She had surgery on 1, biopsies. A new one now appeared. I'm not sure because we don't have pictures, but Nicole, you can email me or Dr. Duarte, send pictures with more details, because it's really not something we can add. Okay, you're from Washington. Come to our conference in New York, Laurel. And Steven says he has port wine on his left hand, laser treatment about 6 years ago with no improvement. Are there any trials for new treatments? Well, Steven, if you're in the US, I can get you a free laser treatment. If you're in the UK and you want to come to Rome, June 27th and 29th, I can get you a free laser treatment. So you can write me if you want, Steven. And we really have to wrap it up. How effective is laser treatment on hemangiomas on the cheek? So if you want to answer that, I'll just see.
If they're thin, but it's combination therapy. So for a thin hemangioma, if this is the correct terminology, because remember, it's important, is it a hemangioma? Is it a port wine stain? If it truly is a hemangioma, certainly laser treatment for the superficial or thin aspect, but you also want to consider the timolol topically. And if it's deeper, then you need to use Propranolol, the hemangio.
Kate, I just want to say I've never heard of a connection between port wine and a glioblastoma.
No,
I've never heard of that. So it's 12. It's time for us to quit. Thank you, Randy. Yes. If you make a donation of $25 or more, Randy, you'll have complete access to our new VBF online library, which I'd like to give a shout out to. I identified 127 key terms in vascular anomalies. We put together a library. We just went live with it. So physicians, medical students, high school kids doing research will now have one place to go, and we'll be able to get all the latest journals.
Fabulous.
And information on this. So we want to thank you all. I want to thank you, Dr. Duarte.
It's been so much fun.
Great. And again, you can reach Dr. Duarte, birthmark.org/Duarte. And you can also reach me, and you can go back and look at this at any time. And for those of you whose questions was not answered, just resubmit them and we will answer. Thank you all. We're going to sign off now.